interactive sessions. We have discussed much about women led development, women empowerment, but in our day to day parlance, our social and cultural expectations put care and chores as the sole responsibility of women. So, to delve into how can we incentivize women's role as a caregiver, because women spend significant amount of time in caregiving roles. We are here to discuss how can we leverage our care economy through which we can achieve women empowerment. So to moderate this session, I call on stage Ms. Suhaila Khan. Please give a big round of applause for her. Ms. Khan has the experience of both grassroots and in global organization. She's the perfect person to guide us through this session. She's a country manager, a country program manager, Women Economic Empowerment, UN Women India. Welcome, ma'am. Now I'll call upon stage Dr. Preetam B. Yashwant, who is the Joint Secretary, Ministry of Women and Child Development, Government of India. Please give a big round of applause for sir. Welcome, sir. Now I call Ms. Priya Anand, Director, Life Circle Health Services Private Limited. Welcome, ma'am. Now I call Mr. Rajiv Ranjan, Chief Operating Officer and Chief People Officer of Dharma Life. Welcome, sir. Now I call Munira Dhabia, Lead Diversity, Equity and Inclusion, Aditya Birla Capital. Welcome, ma'am. And now I call Ms. Karina Bhasin, Program Manager, Seed Stars Global. Welcome, ma'am. I'll hand it over to Ms. Suhaila Khan to moderate this session. You may start, ma'am.
Thank you so much, and good afternoon, everyone, and welcome to this session where we would be deliberating on the economic potential of the and economic opportunities of the care sector. Now, just to set the context for all of us, care work is both an important aspect of economic activity, but also it is a very, very indispensable feature towards the well-being of individuals, families, communities, and society. But unfortunately, it has a gendered phase. It's women who bear the disproportionate burden of care responsibilities, both paid and unpaid. And globally, women spend 2 to 10 times more time on a care responsibility vis-a-vis men. And in India, we are towards the higher side of the spectrum. Here, women spend 10 times. Now, the World Bank indicates a negative correlation between the time that women spend on unpaid and care responsibility versus vis-a-vis their labor force participation rate. But at the same time, what we also see is the rise in demand of care. So, and it is primarily because there are changing family structures, there are changing changing care needs, but also higher care dependency ratio, which means that the economically active population and the overall economy face a great burden to be able to respond and provide the services needed for the older persons and children who are often economically dependent. So ILO estimates that by 2030, the number of care recipients is predicted to be reaching at 2.3 billion, from 2.1 billion in 2015. And this would be driven by an additional 0.1 billion older people, plus 0.1 billion children in the age group of 6 to 14. Now, while the system of care largely depends on the shoulder of women, they contributing through unpaid work, which is equivalent to USD 11 trillion of global GDP. But there is a good news as well. ILO also predicts that if there are right investments made in the care economy, there is a potential to generate 69 million jobs in India by 2030. So there is an urgency then to identify and bridge the demand and supply gaps. At the same time, ensuring that the care workers have access to decent jobs in care economy and their rights and entitlements are protected, but also that the care burden is recognized and the redistribution happens so that care is everybody's responsibility and is not only falling on the shoulders of women. I'm very pleased to have today a set of eminent panelists with us who would be talking about various interventions, including some market based entrepreneurial solutions to meet the care demand uh, and bridge the gap. I'm also very glad to share that some of these interventions are supported by UN Women as part of its Care Accelerator program in Asia Pacific that provides capacity building supports to the entrepreneurial solutions, also looking at that these solutions are gender responsive. So, without a further ado, I would like to turn to our eminent panelists here. Sir, I would once again, thank you so very much for joining. I know you have been traveling straight from Jaipur to join us at this panel, which shows your commitment and which shows your, your respect to this cause and why it is important. Thank you so much, sir. I would like to ask you that what is the vision of the Ministry of Women and Child Development for strengthening women's access to care services? And what are some of your initiatives towards this? And what role do you see of organizations like UN, civil society, and private sector to realize this vision?
Thank you, Suela. And good morning to all our esteemed friends who have gathered here and my co-panelists. So, in our opening remarks, Suela very correctly pointed out the metrics which sort of pin down the uh, the gargantuan task ahead of us because of its structural nature. Now, the ratio of men and women who contribute time to care work in their domestic spaces, which you put across to you, when compared to some of the better figures like North America, Canada, or Scandinavia, where it is about 2 is to 1. Now, the point I want to draw your attention to is not how better that figure is, but despite about 3 centuries of sustained huge economic growth, huge wealth generation, and its distribution in those countries which are right up there when it comes to their social sector interventions, it is still 2 is to 1. It is not 1 is to 1. So that is the structural nature of this problem. So when two working, individuals, husband and wife, let's say, when they go to bed, the guy is thinking, I got office in the morning, my boss is waiting, I got to prepare this, I better sleep early and wake up. Maybe squeeze in a game of tennis in the morning, 1 hour. I can't play an hour, I should play half an hour. But the lady is thinking that I got to pack 3 different boxes with 2 girls who have different tastes, and maybe pack for this guy also. And then maybe I'll figure out something along the way and yet meet my boss at 9 o'clock. So that is the starkness of this whole issue we are looking at. And now, so what we are talking about is also a complete sociological and a thought process which has to change about who contributes to what. So that being said, the we are in times of change, luckily, and times of great change. So I have just come back from Jodhpur and a dusty town, one Manglia Kala, a small village about an hour north of Jodhpur. We met a remarkable lady who is now been selected to be one of the Lakpati Didis, which our Honorable Prime Minister has promised to create across the country. Now, her geographical movement in the last 20 years of her life has been a radius of 30 kilometers. Now, that should strike us right deep in our hearts, actually. I mean, that is her total physical movement, because she stood on stage and said that अब मैं लखपति दीदी बनने वाली हूँ, हमें चैन हुआ है, तो मैंने पंचायत समिति को भी देखा है और उम्मीद करती हूँ कि मैं कल जिला भी देखूँ. So this movement is there and facilities are being provided. So the point we're driving at in creating situations in which women can realize their potential is that they first have to get out of the drudgery of the kitchen. So, I mean, sorry to say so, but that's what it is, and politely park the title bestowed upon them of Grihalakshmi in the side and ask the Griha Ganapatis to actually take up the job, you see. So that is where the starting point is. And now that's happening, luckily. And no better mascot than the Honorable Prime Minister of our country, Modi ji, who has classified that he sees the entire population in चार जातियों में देखते हैं. तो उन चार में से नारी शक्ति और महिलाओं को सर्वप्रथम ऊपरी स्थान उन्होंने दिया है. So sometimes change requires a mascot, requires a proponent of change with a massive personality which will actually drive it into our minds. And that is what is being percolated into the ministry also. So with that context, now, why I wanted to say that is, once again, if the care economy itself is going to throw up opportunities for women, then one does not want to get stuck in, what, I don't know, for a lack of a better phrase, called feminine economic activities. So you have a nurse and then you have a caregiver and so on. So while that's a step forward, one should think that it is to get them out of home, it should be the criteria so that they can do what they want to do. And every woman I saw in my repeated visits to rural India in various states is that the patronizing attitude towards women's empowerment is should be put as a thing of the past, and that is again a dictum so clearly elucidated recently in the G20 women's empowerment, the Empower Women platform also, that we are making a paradigm shift from talking about women's empowerment as a patronizing thing that हम आपकी आप लाभार्थी हैं और हम आपकी विकास करने के लिए प्रयासरत हैं. तो they don't want that. They say that हमें अपना काम करने दीजिए. Just let us do a job and women lead the development. So in that sense, all these opportunities open up, and to free women from the fixed 24/7, drudgery, 7 days a week, 365 days a year is the key objective, one should say. So I thought I wanted to put that in perspective. So it's not just only the care economy which will then, offer them an opportunity to go ahead. It is all opportunities once they are free from what they are doing all the time and not being given credit for. And of course, but the good point is that with the entire conversation growing at such a fiery pace, and in the last year or so, which I've been in the Ministry of Women and Child Development, I have seen this come up everywhere, and it is the discussion in every forum where women providing opportunities to women is being spoken about. So that is a great opportunity for us because it's put right there in focus. It has been computed, and the stats are in front of us. So, to this extent, in the ministry, as a small beginning, there are two aspects of it. We will talk about it as we go along. There are provisions in legislation too under the Maternity Benefit Act. As we go along, we'll speak. I'll come to that. But the one important initiative right now, before I hand over the mic to my fellow colleagues on the panel, is the Palna scheme. Now, there is this scheme has been envisioned and it's in the rollout process to leverage the fundamental, most successful institution of the Ministry of Women and Child Development, which is the Anganwadi. Now, that is an institution has shown resilience for a good 4 decades. It is the largest footprint of the ministry across the country. We have 14 lakh, 1.4 million Anganwadis across the country. They are, serving a population of anywhere up to 5 to 800 women. And there, along with them, we want to leverage it, create it into a care center in which rural women at the places where they live or the place where they work, they have facilities which are of such a nature where they can be at peace of mind that their little one is well taken care of while they pursue whatever little small economic activity which they wish to do in rural India, which is like being a bank saki or being a part of a Swayam Sahayata Samu and doing a little stitching and doing, here's another amazing thing. Things are changing at such a fast pace that technology or opportunity transfers which took place in a hierarchical fashion, that it comes to New Delhi and then to Jaipur and then to Jodhpur, and now there is a direct transfer. As I sat in a camp yesterday in Viksit Bharat Sankalp Yatra, we saw the drone sitting there, 25-kilo drone. I haven't seen it. Now both the drone Didi, the woman of Manglya Kala, and me both had a look at the drone at the same time in our lives. So that is the change. So there's no more trickle down and taking ages to reach the grassroots. There's a program in which women are being inculcated, are being targeted in the Namo Drone Didi scheme, in which the women are going to be masters or the owners of those drones for having an aerial fertigation of lands on a fee. So there is amazing amount of opportunities out there, and we hope that the Palna scheme will succeed in creating daycare centers for the entire period in which women in rural India would like to be engaged usefully in things which they want to and which can take them further and earn their own money and stand on their own feet. I think I'll pause here and then perhaps we'll come back as the discussion goes forward. Thank you.
Thank you so much, sir. And I think on behalf of each one of us here, I would like to congratulate you and applaud on your progressive thinking. You want each one of us in the kitchen, which is very important and central to our existence. But also the fact, sir, that there is like you rightly said, that there's a growing recognition of the of shouldering the care responsibilities by everyone, but also that how there is a potential of the care economy itself. And on behalf of UN Women, and I think the civil society organizations, everybody sitting here would like to say that we are willing to support in any which way towards your mandate and agenda to take this work forward. So thank you so much for that. And Priya, with this I come to you. Tell us about your organization and what was the motivation behind starting it? What challenges do you face in operationalizing and growing your venture, and what are the opportunities? I know I'm asking many questions, but I think these are very interlinked questions, and the motivation is to get people to share about your journey, but also the opportunities that exist and what are the challenges that you are facing. Also, what ecosystem support do you think you need to succeed, to let your organization succeed? Over to you.
Thank you, Suhela. You've given me 7 minutes and 5 questions. So, yeah. So, good morning to everybody. I represent an organization called Life Circle Health Services. We are a home healthcare company. We provide geriatric home healthcare to seniors, geriatric seniors across 5 Indian cities. So, I'm going to start with a little story of one caregiver. And the story spans a period of 5.5 years with us. So, Murchana Chetia, and I have the consent of both the caregiver and the care receivers to say the story, and these are the real names. Murchana Chetia, 19-year-old from Bokaghat, joined us Life Circle's geriatric home healthcare training program, 3-month long, and she made a decision to do the 1-month-long classroom in Bokaghat, and then do the practical training 2 months with us in Hyderabad. So the first leg of the program is a classroom, and the second leg of the program is actually a practical training that happens where we have operations. She came to Hyderabad. She finished her classroom training in Bokaghat and came to Hyderabad to complete her practical training. She finished her course, and she was placed with a family of Suresh and Madhumita, both of them software engineers. And her job was to take care of Suresh's mother, who was in an advanced stage of frontotemporal dementia, and she also had cancer. And the family had a toddler. So Suresh and Madhumita had a toddler. The baby was then about 3 years old. So Murchana Chetia did an amazing job of taking care of this lady. And 7 months after that, she passed away. And when she passed away, the family had a request that we post Murchana for their aunt, this lady's sister, who was a widow, was living alone, and they suspected had undiagnosed depression. So Murchana went there, and in a span of 1 year, with her sunny temperament and the kindness and compassion that she carried in the care she provided to this lady, she ended up being much more than a family member could ever be to her. And Madhumita says that the changes in this lady was very visible to all the family members who have known her. And she passed away in 2020, 2 years since Murchana started her training with us in Bokaghat. Um, and after this, after she passed away, Suresh and Madhumita did not let go of Murchana. They reached out to us, they reached out to me and had a request. The request was that they had motivated Murchana to enroll for a graduate program. She had completed 1 year of graduation, and the request was that please don't post her as a caregiver. Given that she has 2 years of work as a caregiver, can you consider her for office based opportunities so she can study as she works with you? We honored the request, and she worked with us for 2 years. She completed her graduation. And after that, 1 year again, this couple spent another 1 year with her to make her job ready. And she works with a company, a leading company, which is a part of the Accenture group, as a senior software engineer. Now, this is an extraordinary story, right? But what it gives us is it gives us a glimpse into, if a care situation goes well, what does it do for that individual who's a caregiver? What does it do to the family that is receiving the care, and particularly the woman who's most of the times the family carer for the person who's sick? And not to mention the two women that were cared for and had optimal end of life care and good passing, which was enabled through help, right? So I ask Murchana often that, given who you have turned out to be today, and mind you, she mentions on her LinkedIn profile that she was a caregiver. Her first job was that of a caregiver. So I asked her that, was there any point where you felt disappointed in yourself that what am I doing? You know, it also has perineal care, diaper care, right? So she said, no, I think that's the best decision I've ever made. If I hadn't made that decision to join the training program, I would never get out of Bokaghat. I would never meet Madhumita and Suresh, and I would never embark on this journey which has transformed me. And she has huge, aspirations going forward also. Madhumita reflects and says that what Murchana did to her is, by relieving the physical burden of care, she gave her the mental space to think about what more can I do for my mother-in-law that will help her have a good quality end of life care. It helped her give time to her toddler whose 3 year would not come back again. It gave her time to go out on a coffee on an evening with her husband and baby and create those memories while she was assured that her mother-in-law was taken care of, right? So we work. Yesterday, we have a technology backbone which we use to run these operations because it's widespread across 5 cities. It's like operating, if you operate 500 cases, it's like operating, a 500 bedded hospital, except that it is in 500 different locations, right? So technology plays a key role. So as of yesterday, we have worked with 4,885 care workers. And we have partnered with the Ministry of Social Justice under the SAGE program, and with a European leader in home healthcare called Group SOS. Both of these companies are, the government department and Group SOS are our investors and our partners, right? And I think the biggest opportunity / challenge for us is, how do you work on optimizing what I think of as the iron triangle, right? And the three vertices I'm just going to mention. The first one being keeping care affordable and accessible to all. The second vertex is about providing good quality jobs to care workers. The third one is about running a profitable enterprise, which will ensure that I sustain and grow my enterprise, right? So for most of us in the care space, these are the three common challenges. And the way I look at, even our national commitments, I see that as a part of the G20 summit, we have made a commitment to reduce the inequities for female labor participation by about 25% by 2025. I think this caregiving part, whether it is children, whether it is elders, it is going to be a huge job creator. And I tell you from experience that the demand far outweighs the supply. We have much more demand. We are not able to meet the demand. So my first request for support would be that we need a manifold increase of supply of caregivers who are willing to work in homes. And the second part is about creating an environment in homes and treating these people as professionals. That's very important, because Preetham ji talked about getting women out of kitchen, right? Out of care responsibilities of sick elders who are at home. Now, those are very important jobs, and those define, who we are as homes and as a community and nation, right? So we need these responsibilities to be placed in good hands, and we will get those good hands only if we treat these people properly. If they feel that they are respected, they are equals, they have opportunities, and most of these are very young people. My workforce is 80% women, and in the age group of 19 to 22. So it's a very young workforce that I have. So my second suggestion is, can we make social security schemes portable for these people? Can we define pathways of personal growth and professional growth pathways for them? And the third and the last thought that I have is, right now where we operate, we are able to provide care only to people who can subscribe to our services, and they are expensive. So we are able to reach out only to the middle and upper middle income households, but the need is everywhere. So can care become a public good? Can we think of care as a public good? Is there a way it can be financed, integrated into our care systems below the primary healthcare system, and probably in convergence with the Anganwadi system, which also has a healthcare agenda? So I pause there. Thank you.
Thank you so much, Priya. And I think you have taken the conversation to at a very, very high level, which is very, very important. Also, because you talked about the affordability and accessibility. I think that is that is key. But also the fact that very important dimension which we brought about is the 19 to 22 age group, and what is the motivation of these age group to be able to come forward in the care economy as a care workforce. What is it that is driving them to become a care worker? I think that is very, very interesting insight, and also to learn about what is it that is driving. But I think what would also make then care jobs more attractive to them. I think that we need more sort of efforts in order to make sure that in order to meet the humongous demand, the responsibility lies on all of us to be able to create that kind of environment where the dignity of the care workers, like you said, is upholded. So thank you so much. And Rajiv, I come to you. Dharma Life is implementing Better Skills, Better Care Community Learning Center program. So what is the problem that you are intending to solve through this intervention? What is the long-term vision, and what challenges and opportunities do you foresee? And I see the mic at your table.
Thanks, Suhela. And thank you, sir, and Priyaji, for setting the context. My name is Rajiv. I am representing Dharma Life here. Dharma Life is a social enterprise working with women entrepreneurs for last 14 years. Currently, we are working with about 16,000 women entrepreneurs in 14 states. So we have experienced the process of working with women and all the points that has been discussed here so far. So with this background and what we are doing now to address the issue of increasing burden, care burden of these women who are currently already in the process of livelihood, earning, or they may not have got opportunity to start their livelihood journey. So we are implementing one gender inclusive care entrepreneurship ecosystem program with UN Women and Titli Foundation and IDRC. Under this program, as Suhela ji mentioned, that we are piloting learning center with Better Skills, Better Care model in 3 villages in 3 different states. One is in Vadodara, second is in Vadodara, Gujarat, Satara, Maharashtra, and third is in Ranchi, Jharkhand. So very distinctive, distinct demography and geography. So this learning center is going to address what we have been talking about, the care aspect, the care responsibility aspect of women. So in this center, there are going to be 4 segments. The first segment, which is about early childhood care and education, focus on children or the age group 3 to 6 years. So for this center, the course design and development has been done by the early childhood education specialists, and also for the training of the edupreneurs, who are going to run these centers. Their training is also designed by experts like Titli Foundation, who are already working with Anganwadi workers. And the second segment is the space for women skilling, which is linked to the livelihood and based on the local job context and business context. So this second segment, second segment space, is going to deliver vocational training for women in the village, and further they may choose to go for job employment, or they may choose to go for business based on their aspirations and the skills they develop over a period of time in this center. After that, they'll receive mentoring, on the job, hand holding support, and further required market linkages if they choose to go for businesses. Now, the first 2 segments we have already implemented. I'm going to talk about 2 more centers, 2 more segments of these centers, which we are going to do in next phase. The third one is about, which is a new thing that we are going to do, is a gender positive space. In this space, we'll be delivering UN Women gender training programs, and also will bring people and from different households through behavior change communication campaigns, and engage them in a dialogue where we'll be talking about how to offload the care burden. And here we'll invite couples primarily. And we'll also talk about, going forward, how to address the need of paying attention towards unpaid care work. And third part that we'll be discussing in this space of gender positive space, where we'll be celebrating basically the success stories of co-parenting and co-working in the household space. And the fourth segment of this learning center is open learning center for the community. We'll have library there, and also we are going to run late afternoon classes for school children who want to understand more about different subject areas. Right now, we have developed courses for mathematics, English, and MOOC lessons. And this is going to be all integrated in one space. Now, what are the some numbers going to be as a result? So I will share in brief the basic numbers per village, per center. We have sensitized in each of these villages, for each center, about 120 women about this care space, the work that we are doing, and the opportunities that are there available for them. Out of 120, we saw that around 40 women, they came forward and asked us for more details, and so we did counseling, with 40 women. Out of that, actually 15 to 18 women actually came forward for the training, and they had their own aspirational learning requirement and skilling requirement. And we see, since the pilot is still in progressing, and we already see that about 8 to 10 women are going to either take up job employment or they are going to start their own business. And so these are the basic numbers that we have seen in this funnel. So that is for women. For children, how this is going to be. For around 25 children are registered till now, who have gone, getting all necessary, learning inputs that is getting them ready for their primary education. Now, this is again, experts have built the program, which are working around different cognitive framework, and we are going to see that the learnings should be linked to the 21st century skills that we have been all talking about now. Now, who are running these centers? That's the question will come. And that is the key here, where we have got very good insights and inputs from the team that we are working with, including UN Women and Titli Foundation. They are going to be called edupreneurs, education entrepreneurs. So they are going to run the centers, one for women skilling, second for children education. And they are going to be the part of the care sector that we are talking about, that we are building now. And in this process, we are seeing that lots of strong data points will emerge out of that. And this center and this entire program has got very strong research background. We have done participatory rural appraisal that we do in all rural areas before starting any work in any village, followed by focus group discussions, household level discussions, individual discussions. And then we have done baseline, and by September 2024, we are hoping to close the end line process, and we are going to test many hypotheses. And also we are preparing ourselves for RCT, where we are going to test all the vital components that we have just discussed about. Yeah. So more I will discuss and during this.
Oh, thank you, Rajiv, and thank you for also sharing about this an integrated model where I think the focus was on how to bring more women into the skilling space where they are able to realize their economic potential, while at the same time not being concerned about their children, the safety of their children, but also how the children are spending the time. So this integrated model is providing that space for women to be able to learn skills and get access to livelihood opportunities, at the same time looking assured of the fact that their children are taken care of. Munira, I turn to you now. Aditya Birla Capital is a women's empowerment principal signatory, which means that your CEO has committed to promote women's empowerment and gender equality in the workplace, marketplace, and communities. My question to you is, why does it make sense for Aditya Birla to address employee care responsibilities? And what are your interventions and what internal factors have made it possible?
Thank you, Suhela. Hi, everyone. For us at Aditya Birla, I must tell you that our group purpose is to care for our employees. The culture, the value that we have, care is deeply embedded in the system, right? And we live by it. I want to tell you, when I joined Aditya Birla, I was told, or when I was joining, I was told that this is an organization that cares for its employees. I got to know, I was told about this by many people. At that point in time, I literally didn't understand what it meant, But when I got into it and, when I saw that how we deal with our employees, how we understand and provide for their needs, how we nurture them, I understood that statement. In the context of today's conversation, which is care economy, like Suhela mentioned, we are 10 times women work more, 10 times in livelihood and care, right? We wanted to address that because we saw that women were taking sabbatical or career break or not returning to work because they had care responsibility to manage. And that is what we wanted to address. And what we did is, with that thought, over a period of time, we built such great, amazing best practices and unique practices that allow our women to come back to work and continue to work while take care of their caring responsibility. And I want to highlight some of them today. Our motherhood program, we call it Celebrate Motherhood. It's one of the fantastic program in our sector. In BFSI, it's one of the best programs that we have. We provide creche facility, we provide nanny allowance. Our nanny allowance is about 10,000 rupees per month given to every woman who has a child under 6 years and per month. And they get it till the child is complete 6 years, irrespective of whether the caregiver is a professional caregiver or somebody at home who's taking care. And that's just phenomenal because women can come back to work at ease and they don't have to worry about whether they are financially secured in terms of nanny allowance or creche facility. We also have a travel policy for women who have newborn. If they have to travel for business purpose, we provide them allowance for their nanny for the child, whether it's domestic or international, all of that is taken care of. I think some of those practices have really helped us to bring women back to workforce after they've completed their maternity leave. We also run an employee resource group for women who are mom-to-bees or new mothers. They come together. It's a community that work and they provide support to each other. And as an organization, we support that community to quite an extent. We make sure that the community is engaged, the network is motivated, and we keep taking feedback from people from that community. In fact, to be honest, most of our practices have evolved because of the feedback that we've got from our women who've been on that community. Of course, we have a lot of other things which for making sure that care is not just for women. We have paternity leave, we have caregiver leave. Also, beyond childcare, we have elder care support programs that we run. We have an entire platform where employees can reach out or go and look for services for elder care. Because if their parents are in another city or in another state, wherever they are, if they need any support, backup services, whether it's physical, whether it's psychological, whether it's a doctor support, all of that is a platform that they can just reach out and get that support. So we do a lot in terms of making sure that we want to take care of our women, especially, also all our other employees. And I must tell you, we are invested in this even financially. A strong investment, the vision and the commitment of our chairman at the group level and the leaders is to enrich lives of people in our ecosystem. And that is what we'll aim to do. I think, but in my view, I would still want to say that I think there is a scope to do much better in terms of care responsibilities and care services and care practices. I think what we see, and this is a conversation that we continue to do with women in the organization, we see there's a growth of nuclear families, right? We see there is an increase in people traveling for business purposes. There's a lot of business travel that happens. There's a lot that people want to take up roles which are in different parts of the countries, right? And their families is somewhere else. So there is a need of childcare, definitely, but there is a need of elder care too, which is often neglected. That we don't think about elder care, we continue to think about care as childcare. I think as people right now, that how we have gathered as private organizations and government bodies, I think together we need to really build on these professional care services, because that will help women to come back to work. Look at care from all aspects, whether it's childcare, whether it's elder care. A lot of things that we can do, right? Make paternity, make childcare leave or paid caregiver leave, which is make it mandatory. It's very easy to do that. Maybe there are a lot of organizations who have that. Provide care resources to organizations. I think it's very important that we have access to care resources that we can give back to our employees, or maybe have subsidized care services that we can gain out of it. Organizations like ours, which is very focused on caregiving, responsibility, and taking care of caregivers, I'm sure there are many other organizations like that in India. I think why don't we, look at amplifying that? Look at how we can give benefits to those organizations who are really paying attention to this particular aspect of life cycle. I think that is what the need of the hour is. Today, when I'm actually talking to women in our company, you know, the days when you actually hear this thing, right? That we need hybrid working, women asks for home working from home and flexible working. Have you actually thought of looking at why is that? Why is it that a woman is asking for flexible working or hybrid working or work from home? I think let's address that piece to bring women back to workforce, or to make sure to let them thrive in their career the way everybody else wants to. I think that is something the need of the hour today is. For Aditya Birla, at least, we have an entire organization set up at a group level which looks at enriching lives of people, from women who are restarting their career, elderlies, and also civil servants. And yeah, that is from my end. That's about it.
Thank you, Munira. And I think the main key takeaway for me is that this is coming from the highest level in your organization, and there are financial resources to back up that commitment. So I think that is very important. Karina, I think last word goes to you in this panel, which is you are also one of the partners of the UN Women's Care Accelerator that is capacitating care enterprises to grow and expand. Access to finance is one critical element, and what gaps we still need to close regarding this? What would enable more investments to flow in care enterprises?
Thank you, Suela, and thank you everyone for making this not so very cold day feels very cold. So warm afternoon to everyone, and thank you for my co-panelists for sharing all the metrics. I'm feeling very happy at the moment before I just delve deep into the question, because the program that we are part of, GSIP, which is Gender Inclusive Care Entrepreneurship Ecosystem Program, most of the stakeholders, Dharma Life, one of our care entrepreneur, UN Women, we are all sitting together, and it feels like the program is echoing on the panel right now with all the work that we are doing on ground from the last more than 6 months. So Asia Pacific Care Accelerator Program is one of the pillar, which is pillar 2 of the bigger program, GSIP, funded by Visa Foundation and IDRC. And the pillar 1 is what Dharma Life is doing along with Italy and UN Women. And pillar 2 is basically this care accelerator, which is now the cohort 2. And to begin with, COVID-19 basically showed us that, evidently bring into attention that the care work and the care responsibilities has been increasing, and it created an opportunity for innovative business model. It created an opportunity to bring attention that the care work needs to be redistributed, the women is going back to, is dropping out of the workforce, and we need to bring them back, but also bringing attention that the care is not limited to child care. The care is about elderly care, the care is for the people with special need, and there is a care which is beyond healthcare. So we started the Care Accelerator program in 2021 with 13 enterprises, and now we are in the cohort 2. This is our cohort 2 of running in APAC region, not limited to just India, but in Bangladesh, and mostly in the South Asia region, Bangladesh, Pakistan, Bangkok, Indonesia, and India for sure. So with these 13 enterprises, we are an early stage 10-month-long accelerator program, which is specifically running a care-specific accelerator, which means building impact-focused business model, impact-inclusive business model, which are very gender-responsive. So this integration of business and gender together is something we are working throughout these 4 different modules. And here comes the thing that we have with 4 different modules, we are monitoring 5 different type of progresses. One of the business module, one of the program module is on finance and fundraising, and one of the 2 of the specific track is finance partner track and gender equity track. Very proud to share that, firstly, as a part of gender equity track, the way Aditya Birla is a part of WEPS, Priya's organization is a part of WEPS. So that what this accelerator program is doing, that even an SME and even a very big organization, how to become that care and gender responsive business. That's one. Second is how to get the attention of financial partners into the care economy, because we know it is a fast growing economy and everyone's attention is coming into it. Even government is making all the policies, the right policies and intervention. But to go in there, would like to bring attention that we research is the cornerstone for to bring any policy in, and bring any evidence in order to say that this kind of investment is required. So recently, earlier this year, the pillar one came up with a research paper with Value for Women of how to catalyzing investments into care economy and bringing that how to framework for the investment. So that is an important piece of work that we did to bring all the kind of blended finance approach, different kind of finance approach, even for the VCs, their entry points, what kind of entry points it's required. The way we said that what is that currency, and when we talk about the currency, I'm speaking that what is the currency for that 19 to 22-year-old women or men who is also a caregiver is gender neutral term at the moment, and it is a gender neutral term. So when a 19 or 22-year-old individual come for care work, to take up a caregiving job, what motivation, and that motivation is currency. So how that currency we can bring into the eyes of the investors that please come and invest, because there's a huge gap in creating that supply chain, in bringing that training and skilling certification programs, so that the supply chain, which is a big challenge for our entrepreneurs at the moment, and with these 13 enterprises which have traditional approach and tech driven approach to provide care services ranging from child care again to elderly care, they have limited access to care providers and to caregivers and care providers. And now these caregivers also, the retention, their conversion is also low. So now then, when we started, the vision was to make care accessible, affordable, and quality care. And with Care Accelerator, leading by an example, we are saying we are 2 steps ahead in making it affordable and accessible. And to make it affordable and accessible, sustainability and scalability of enterprises like Life Circle and others is the key. And for that, we need financing partners. And after all of this research, and this research is primarily with Care Accelerator will be doing with high middle income and high basically income individuals, families, that being able to take care services from enterprises. But with pillar one, like Dharma and Titli Foundation is doing, we are doing this research work in seeing the BOP model, basis of pyramid, that how these low income communities will be able to get an access to care services. So this kind of an approach will give us a complete framework that when we say about blended finance, I'm talking about philanthropy, I'm talking about grants, I'm talking about how can we bring that care lens, which, as Suela mentioned, has a gendered face to it. So earlier we were just talking about we need to have a gender gender focus investment, but now we are saying we need care lens investment also. And for that we are doing research work. For that we are bringing financing partners, setting one-on-one meetings with our entrepreneurs, specifically running it throughout 10 months, and not bringing just the financing partners from India, but across the region globally to understand, and from the different backgrounds. They are angel investors, they are philanthropists, they are CSR foundations. Also understanding what are the challenges at the end of the investor, because most of the times when our business enterprises were going and pitching, just to bring into attention, they were not aware that they are making impact What they saw was a business opportunity because there was a gap, just like an entrepreneurial thing. That's what an entrepreneur do, like, making most of the opportunity in the market. But this care accelerator is bringing that impact lens, that be gender responsive, you are creating an impact, and pitch that to the investors and let investors see it. So we need patient capital. We need blended finance, but we need patient capital. We begin with our vision is also about how to make this fast growing economy highly resilient, and like it's growing and is resilient. So when we say growing and resilient, we say that we need finance, but the financing partner needs to be patient as well, because maybe the ROI is not immediate, right? So these are the gaps, and also these are the gaps, these are the opportunities, and we are coming up with evidence based research to become a guiding force for the civil societies, for UN entities, for private entities like C-STARS, and the other organizations, specifically for the investors as well, on how to invest, where to invest, and for the enterprises as well, and how to pitch themselves to attract the investors, to get their confidence, to basically also shape their model in such a manner that the technology doesn't look like a vague thing. For example, Priya's enterprise has three different apps, which is a traditional organization but very tech driven. So how can we bring the attention of the financing partners to it? So this is what this program is doing, and yeah, thank you. I'll pause here.
Thank you so much, Karina. And I know we are just on time. I am afraid that we would not be able to open up for the question answer session, but would welcome you all to have the opportunity to converse over lunch. In conclusion, what I would like to say that the care agenda has to be everyone's agenda, not of a particular ministry, not of certain kind of private institutions, not of certain kind of financial institutions. It has to go to our dining tables at our families. It's high time that we start talking about redistribution of this work at our household level. What is heartening is that this agenda is gaining recognition, but much more needs to be done. And I believe that the panel today gives hope and positivity towards this entire agenda. So I would like to thank all of you for wonderful, wonderful insights here, and look forward to continue working and supporting. Thank you so much. Thank you.
I thank our moderator and all our panelists. I would ask you all to please gather for a group photo. I request all our panelists to please gather their kit. Will be